Hi, good evening. This is Dr. Mukesh Tiwari. I'm a small animal practitioner practicing in Bhopal, India. Today I'll demonstrate you how to take the blood pressure by a doppler blood pressure monitor in a dog or a cat. First, I'll explain you about something about the machine. This is my doppler blood pressure monitor. This is VMAT Vet Dog 2 model. This is made in USA model. In this monitor, there is a button to switch on or switch off the machine. By the side of this, there is a point. That is the jack for the headset. This headset is available with the machine to hear the blood flow sound. We can attach this headphone here like this. Okay. In day-to-day practice, generally I prefer to use the headphones because if I'm using the headphone, sounds are very audible and it don't irritate the animal. But for the demonstration purpose today, I'm not using this. You can please keep this aside. And by the side of this jack, there are 2 points to increase or decrease the volume of the speaker. There is the speaker, there is the charging point, there is the battery indicator. On the back side of the machine, there are 2 points. One is the charging indicator, second one is the sensor indicator. A sensor line. This is the at the end of this sensor line there are piezoelectric crystals which emits 9.75 megahertz ultrasonic waves. This is a highly sensitive part of the machine. This is the pressure pump by which I can inflate the air in the cuffs, and in this there is a sphygmomanometer in which I can see the reading. And these are the different sizes of cuffs available with the machine. There are 6 different sizes so that I can take the blood pressure from a very small kitten to a huge dog. Okay, and this is the gel. Today, for the demonstration purpose, I have taken this dog. This is a beautiful golden retriever dog. For taking the blood pressure in dog and cat, we can take the blood pressure from the foreleg or hind leg or from the tail. In foreleg, there is a radial artery below the elbow joint or the metacarpal artery here in this location, and in the hind leg, there's tibial artery above the hock joint and the metatarsal artery here and the coccygeal artery here. Okay, for the demonstration purpose today in this dog, I have chosen foreleg. In foreleg, there is a radial artery. Okay, for taking the blood pressure, it is important to shave the hairs, because if the hairs will be there, you won't be able to listen the blood flow sounds clearly. And for taking a meaningful blood pressure, it is must to make the dog calm. If the dog is in excited state, then chances of error will be there. Presence of honor is also very important to make the dog calm. So if dog comes to your clinic at least for 15-20 minutes, allow him to get settled there in the clinic. Okay. Today in this dog, I'll show you to take the blood pressure from the foreleg. Okay. For taking the blood pressure, this is very important to select the appropriate size of the cup. First, I'll take this cup. In this cup, there is an index line. This index line should fall in between these 2 lines, which are very clear here in this cuff. Okay, this should be like this. This index line should fall in between these 2 lines. Otherwise, you can take this width as an indicator. This width of the cuff should be more than 50 to 60% of the circumference of the limb you are using. This is the limb, and there should be more than 50%. Okay, of the circumference of the limb. This width. Okay, for this dog, I think this is appropriate cuff. Okay. I'll show you how to use this cuff. There's the artery line. Yes. And now I'll attach this pressure pump with the cuff. Okay, so that I'll be able to inflate some air in the cuff. Okay, and this is the monitor. I'll keep it here. And this is the gel. For making a good contact, it is must to apply the gel there on the selected area and on your sensor. I have added this cuff with the pressure pump. You are able to hear the flow sounds. Now I'll increase the air pressure. At 200, there is no blood flow, there is no sound. I'll start slowly releasing the air with the help of this knob. Again I'll repeat. At 140 there are sounds. I am going lower than this. Blood flow sounds are there. Even at 0. Now I'll increase the pressure. .160 sound is there. 220 there is no sound. I release the air. Try to listen it carefully and note the reading. Sounds are clear to you all. So what is the basic concept? What we used to do generally, there is a blood flow. We used to inflate some air in the cuff. Air flow occluded the blood circulation. Then there is no sound. Slowly, with the help of this knob, we start reducing the pressure in the cuff. As the pressure goes down, at a particular point, blood flow resumes. At that point, we have to take the reading. That would be our systolic blood pressure. Where the blood flow resumes, that is our systolic blood pressure. In dogs, generally we used to take the systolic blood pressure. In dogs, we don't used to take the diastolic blood pressure. For dog, average value of systolic blood pressure is 120. But in a clinic, generally in between 100 to 150, we consider normal systolic blood pressure. And in cats up to 180 200 we consider normal. If blood pressure goes beyond the 150 in dogs and more than 200 in cats, then we can say that it is a case of hypertension. Hypertension generally occurs in dogs and cats in a cardiac problem or in a renal problem or in hyperadenocorticism or in diabetes. For managing such cases of hypertension, we can use furosemide, we can use atenolol, we can use enalapril drug. And if the blood pressure goes less than 400, then you can say that this is a case of hypertension. Hypertension generally occurs in animals in case of volumetric loss, like an accident, blood loss in an accident or dehydration. For managing such cases, we can use the fluid therapy or we can use the blood transfusion. I think this is a brief discussion about the blood pressure in dogs. Hope this will be very helpful for the beginners. I'll keep posting such videos. Please like and subscribe my channel. Thank you. Bye bye.